Hi, I'm Mara Markzon. I'm a licensed clinical social worker and an accredited case manager here at Northwestern Hospital. I've been here since 2007. So I feel like my whole life I grew up with everyone telling me that they thought I was going to be a social worker when I grew up. My nickname at overnight camp was the Jewish Mother Teresa. So everyone kind of had it in me that I was going to do something helping others. My mom was a teacher, and I come from a long family line of teachers. So my mom always wanted me to be an educator in education. But I truly believe kind of everything happens for a reason, and that the universe kind of had a different plan for me and my career path. When looking at graduate programs, I applied to the School of Social Work, but specifically to the school social work specialty, but wasn't accepted into that program because it was full and was told to pick another specialty, and kind of just picked medical social work by happenstance. The first time I had ever been in a hospital was the first day I walked into my internship as a graduate student, but I've never looked back. I think healthcare and the hospital is where I've been meant to be, and glad that I ended up here. In terms of urology, I definitely didn't start my career in urology. I started my career doing general medicine and orthopedics. Here at Northwestern, I did general medicine for my first, I think, 5 years, and then switched over to doing inpatient surgery and worked with the urology patient population starting there. I worked urology, vascular surgery, and trauma surgery, and kind of loved that mix of those three inpatient. But in April of 2021, I was approached and presented with the opportunity to participate in a pilot in the outpatient urology clinic here. I was the natural fit for this position, having had the background with the inpatient side, and thought what a great opportunity for me to create this social work role from the ground up and really be involved in what social work looks like in the outpatient clinic. Not just urology, because I think that the future of social work is in all of the outpatient clinics here at the hospital. So that's kind of how I ended up here in urology, and it's amazing. So my role is now fully outpatient, so I don't go inpatient at all. And we have quite the large urology clinic here with, I think, 18 or 19 physician providers. I think almost 9 or 10 mid-level providers. I don't even know how many nurses we have. So every day there's someone in clinic, there's someone operating. So every day there's a lot of pieces kind of moving. So I don't really have a typical day. No 2 days are the same for me. I come in the morning, check my email, check my Epic in basket to see if anything had come up from the prior day. I have certain physicians whose clinic schedules I comb through to see who they're seeing that day. If it's a patient that I already know that maybe want to pop in and see, or if they're maybe doing a new surgical consult on someone that I think may end up being a referral to me, I like to try to catch them in person if I can. Though many of our physicians see patients from all over the state and all over the United States, so I'm not able to catch every patient in person. So I do a lot of phone calls during the day, calling patients to connect with them. I also look through the surgery schedules. I try to look a month in advance to see if someone's scheduled for a surgery that maybe I haven't connected with yet, that would benefit from a touch point with me to talk a little bit about what their post-surgical care is going to look like. My goal is to at least have a touch point with every cystectomy patient that's getting their bladder removed, just because it's such a major surgery and such a life change and lifestyle change for them that I like to connect before they have their surgery. I also am consulted in real time by different members of the team, from the surgery schedulers to the admins to the nurses, mid-levels, doctors. Everyone can kind of pull me in on a patient. Even yesterday, something came up in clinic. They pulled me in while the patient was here. I run a support group specific to women who have bladder cancer once a month. It is a Zoom support group. So what started off as a local support group has turned into a national support group. We have women coming from all over the United States to attend our group. And then we're also in the works of starting a new adult spina bifida clinic. So I'm working with Doctors Kielb and Bowen to help start that new clinic and look at what it looks like to transition these young adults from the Lurie Children's world to our world here at Northwestern to make that a smooth transition. A lot of times we'll have patients that come to us in mental health crisis, or maybe disclose intimate partner violence while they're here in the clinic. Those are things that I can help address and make sure the patients are safe and their needs are being met. And sometimes it's as little as they've soiled their clothes or something's happened and they need help with a change of clothes or even rides to and from the clinic. Those are things that I can help address as well. I think that my role has a direct impact on both avoidable days and length of stay. The pilot I did in April of 2021 kind of gave us a really good idea as to what impact I could make on the inpatient side, and it was drastic. So in I think it was a 3 to 4 month pilot, we were able to decrease the avoidable days that were attributed to patients and families from an average of 3.8 days down to 2.2 days, which improved capacity on the units and provided an opportunity for increased surgical volume. There was more room on the urology unit for the urology patients. We also were able to decrease the average length of stay of these patients from 5.6 days to 4.2 days, which is huge when it comes to infection prevention and a lot of other kind of resources in the hospital. I think that I bring a skill set to the table that other professionals just don't have. I think that the social worker looks at every individual as a whole person and is really focused on self-determination and making sure that the patient's voices are heard and that they have a seat at the table when it comes to their medical care. I think that social determinants of health is becoming much more prevalent, and those social determinants of health are needs that we can help meet for the patients and that we can address by linking to community resources. We also give other professionals the opportunity to focus on what they do best. So when a social worker is in a clinic, that means the role that the social worker would take on doesn't have to be done by the other professionals in the clinic. We can do what we do best, and we're aware of resources and community opportunities that other professionals just may not be aware of. I come here every day and have been coming here every day for 15 years because I work with such amazing professionals and people and the patients that I see, and I can't imagine working anywhere else. This is the best place to receive care and to provide care. Well, I am so thankful that I've been given this opportunity to talk about all of the great work not only I do as a social worker, but my department of over 100 social workers and social workers in all over the institution that are outside of my department get to do every day. I'm so thankful that I got to be here, and I'm appreciative of everyone's time.